Hi, everybody. Welcome to the Dr. Ardis Show. I'm your host, Dr. Brian Ardis, and I'm excited for this show. This is going to be a show not like any we've done before. Actually, it'll be similar to some we've done before. However, many people around the world walk up to me and ask me, Dr. Ardis, how do I actually get my blood pressure to be normal without drugs? Or do I need to worry? I have grandparents, parents that all have high blood pressure on medications. How do I prevent myself from developing high blood pressure in the future? I don't want to be succumbed to being diagnosed with high blood pressure for life, being told it's a genetic issue, and now you're going to have to take these drugs for the rest of your life because there's nothing you can do. I also know that this is going to be published a week after Mother's Day, but I want to let you all know, I hope you had a great Mother's Day and spent time with your mother or someone you consider a motherly figure who you love, admire, and revere. Mothers actually play a pivotal role, I believe, in my own personal life in raising us, nurturing us, and teaching us basic principles of how to be kind to others and navigate society. We'll be right back after these messages. All right, welcome back to the Dr. Ardis Show. I'm your host, Dr. Brian Ardis, and I am so excited. I have back in this show with me Dr. Thomas E. Levy, cardiologist, who was based in Miami. I'm not going to tell you where he is, but this guy is phenomenal. He's written multiple books we've all taught you about. Death by Calcium. Let's see, the Toxic Tooth. I believe that's one, right? Thomas E. Levy?
Yes, sir.
And then Magnesium and Curing Most Diseases with Magnesium. This guy's a wealth of knowledge. He's a current researcher, still publishing research. And I'm honored to know him, be affiliated with him. And about it's been like 3 or 4 years ago, when the COVID-19 vaccine started being introduced into teenagers, there was this issue with myocarditis, highly being diagnosed after 7 days of the second Pfizer shot in teenage years. And the teenagers were having this being more diagnosed within a 7-day period after the second shot than adults were having. And so I had at the time 4 teenagers, and I thought it very important that I get a cardiologist who has respect in natural principles, things like hydrogen peroxide and other things, and magnesium, perspectives on calcium the rest of the world doesn't have, and then has published and done research consistently for decades. I asked Dr. Thomas C. Levy to join me for the Dr. Ardis Show and produce a few things called 10 for 10s, which were how do we address, from a cardiologist standpoint, my naturopathic, chiropractic, acupuncture background, what did we use clinically to see people's lives improve naturally without medications, and then helping people eventually even get off medications. That was always a big deal that we wanted to do for my patients in the past. And lots of people are circumventing around to this topic now that we moved outside of the pandemic. Lots of people come up to me around the world and go, Dr. Ardis, just yesterday even in Columbus, Ohio, multiple people were standing in line at an event I was speaking at and said, Dr. Ardis, how do I lower my blood pressure naturally? I'm tired of swallowing synthetic snake venom from a Brazil viper, which are called ACE inhibitor drugs like captopril, lisinopril, anything that ends with pril. And as I introduce this concept and knowledge to people that they've never heard of before, they immediately want to stop them. My first reaction is to tell them, don't stop those immediately. That's ridiculous. If you're wanting to do this, though, there are ways, and your medical doctors can help you titrate off of those slowly, which means to reduce the dose over time while changing your diet, while adding in specific supplements you're learning from us and others in research papers that have been found to have value in lowering blood pressure. All right, so I want to bring Thomas E. Levy here. He's back again. Let's bring him on. Say hi to the audience. This is Dr. Thomas E. Levy, cardiologist. How many years has it been now? 40?
Oh, something like that.
Wow. Well, I'm 47. That means I'd have been 7 years old or so when you were about ready to start
That
practicing.
sounds right. You're a young whippersnapper, no doubt about it.
I'm definitely that. All right, Thomas E. Levy, how are you doing? And tell us what you've been up to lately.
Well, I've been up to my eyebrows. You didn't mention it, but I'm in the process of moving to Puerto Rico. And anybody that's ever moved and dealt with banks and applied for mortgages know it's an overwhelming process. But when I finally gave them the results of my last colonoscopy, they went ahead and gave me the mortgage. So, but other than that, everything's great, and I'm not complaining. I'm looking forward to the move. I love Puerto Rico, and hey, sometimes you don't know where life's going to take you, but that's where it's taking me right now. So
Well,
definitely
are you
great to be here
anticipating
with
getting
you,
some
sir.
land on that island?
Well, the home I'm looking at has a nice little piece of land on it as it is. I mean, not like super acreage, but it's not one of these wall-to-wall places with other homes. So that's another nice thing about it. Even though it's a small island, I'll have a lot of space. And at least for me, peace of mind and quiet are the most important things for me as to where I live. Everything else is secondary, even though there are other important factors.
Hold up. Did you not find Miami quiet and silent and serene?
Not too much.
Just kidding. From Miami to Puerto Rico, I'm assuming the weather's very similar. I imagine it would be.
Similar, not as hot, and I don't think as muggy. So it's
Oh, good.
and being an island, you get a lot of consistent breezes, and so you don't have many days that are completely stagnant. That's really when the heat and the humidity start to boil your flesh, is when it's hot and humid and stagnant.
Well, how long have you lived in Miami, where it can get very stifling humidity wise? And in Dallas,
Oh
where I am, very stifling. New Orleans, where all my family's from. Oh my God, the humidity is like
my God,
sitting
yeah.
on you. It's
Well,
awful.
I was at Tulane, so I did a lot of time in New Orleans too. Yes,
May and
and you're
June are
right.
awful.
You're right. With
Oh,
industrial strength mosquitoes. Yes. Now I've been
it's
6 years in Miami, but so time to move along.
very good. Congratulations. What's your most recent research paper you've written up? What article? And what's the topic? I'm just curious.
Well, probably the one that says and asserts that root canals cause breast cancer frequently. Okay. And I mean, I can't make it any clearer. All these poor ladies out there that are just, along with their physicians, docs, and healthcare providers, completely misinformed, uninformed. But oh, the ladies that just go straight to the chemotherapy, that's such a shame and such a needless waste of health, needless loss of breast, the whole ball of wax. It all comes from the mouth. It all comes from the mouth. And the article has a mere 260 references in it. So none of it I'm just pulling out of left field. Amazingly enough, as you know this very well, Dr. Ardis, just because something is not well known or widely accepted doesn't mean it's not clearly documented in the
Very,
literature,
very
which
true.
is the case here.
And my audiences have learned about many, many things that have been documented in science paper after medical journal and medical research paper. But it appears no medical doctors even know anything about this stuff. It's very odd to me. I'm like, how do the government health agencies not talk about this? I cannot believe how many things are well known and established in medical research proving that nutritional things and alternative healthcare can provide many, many benefits in the lives of people. It's not just drugs. It's not just vaccines. It's not just chemotherapy. It's not just surgery. There are a lot of things that,
Oh,
shockingly to me, have been withheld from getting either from those journals to the eyes and ears of a lot of the medical professionals,
well,
unfortunately.
one of your best examples is vitamin C. Okay, vitamin C probably has over 80,000 articles on it in the literature. And
Wait, did you say
doing
eight?
all sort of
Wait. Did you say 8 articles?
80,000 articles.
80,000. Holy cow, it's a lot.
Okay. And doing crazy, wonderful things like neutralizing poisons and curing infectious disease and ameliorating cancer and a lot of other diseases. But guess what? Our esteemed textbooks of medicine don't mention it at all. They don't. I mean, something that has done that with 80,000 articles in the world literature is not even mentioned in the medical textbook. I mean, that pretty much summarizes ignoring slash suppressing something.
1,000%. I 100% agree. And yes, my audiences know that. I find it disgusting. I'm like, oh my gosh. Like, for example, the thing the most recently for me, Doc, has been over the last year, I did not know this, but I wanted to know, is nicotine only in tobacco plants? Like, of all the plants on the earth, is there only one that actually manufactures nicotine inside of it? I had no idea until the last year. And I'm being flown around the world right now to educate people on what the benefits of nicotine is found in plants. And I'm like, this is amazing that no one talks about this. But when I put it up on the screens, I'll show them the vegetables they've been eating their whole life that has nicotine in it. But none of them have ever known this, Doc. Not a single person has ever gone, yeah, I knew that. No, every medical professional, every lay person, every citizen's always like, wait, what? Nicotine's in my white potatoes, every mashed potatoes I've ever eaten, every potato chip I've ever eaten, every French fry I've ever eaten. Yeah. Every time you went to Chick-fil-A and ate that waffle fry, it's got nicotine in it. Every eggplant, every zucchini, every red tomato, green tomato, bell pepper, cauliflower, celery. It's been amazing to realize that they bastardize tobacco so often and just tell you, avoid this substance because it has nicotine in it.
No,
but they don't.
you certainly opened up my eyes on nicotine. And
It's wild.
I mean, as a cardiologist, what are we told from day one, about smoking, nicotine, this, that, or the other, and then everybody goes on Nicorette so they could get off of the cigarettes. So no, your stuff was pretty. Knowing what we know about how things are suppressed or ignored, I wasn't stunned or surprised out of my mind, but I was impressed with the data. Yes.
And I will share with you here, only because you're a cardiologist. This is not the point of this show, but it is related to a cardiovascular issue. There's this thing called myocarditis I mentioned earlier with these kids receiving those COVID-19 shots early on. Myocarditis, a lot of us, including me, had never heard of probably before these COVID-19 vaccines came out. Very few have you seen. I remember asking you in practice and in your career, how many myocarditis cases have you seen? Peter McCullough, I asked him. He's like, none. Okay, great. In 30 years, I got it. All right, so this is a very common, but it's now like, it's as common as almost any other word in the English language now, it feels like.
Right.
In science. It's crazy to me in a few years. But what I was really shocked by, I couldn't believe this, Dr. Levy. And if I haven't shown you this, I got to send it to you. They actually did a study during the pandemic, so in the year 2021, and they actually took myocarditis animals. They injected them with Coxsackie virus that would induce myocarditis in those animals during the
traditional
pandemic.
form. Yes.
Yep. So they created myocarditis, and then all they did was inject them with nicotine for 3 days. And after 3 days, by day 14, all of the scarring of the heart was reversed and myocarditis was completely reversed. How many cardiologists know that they have studied nicotine in mammals' hearts with myocarditis triggered by a viral injection? How many know that they used nicotine and proved they could reverse the scarring even of the heart's myocarditis in 14 days or less with nicotine? Anyway, I found that miraculous. Did not know that was a
My
benefit
guess
of
would be
nicotine.
less than one. Less than one cardiologist.
And as I put these up on the screen everywhere I go, I'm like, did y'all know this? And how many cardiologists are telling you and your teenagers who now have myocarditis and college kids?
Let me tell you a little
Here's
something
some
about
nicotine.
the pandemic myocarditis, because this is recently I put this together and I've just been amazed at the
Please
pieces
do.
that are coming together, which is we find something that attacks the young people more than the old people. Well, for one thing, young people have something called commonly early repolarization, which by itself is a complete normal variant on an EKG.
I don't even know what that is. You're gonna have to
But
define that for me.
it's an area where you have an ST elevation. It looks like you're having a heart attack, but you're not. But it does represent the fact that even though it's occurring naturally, it's a point of electrical instability. So no other factors, no problem. But then when you put in the spike protein, then this can become highly irritable. And this is not only one reason why this happens. The other reason too is that everybody accumulates heavy metals and huge amounts accumulate in the heart. The heart is very high, metabolically active, and it will selectively concentrate the heavy metals more than any other organ. And we know in congestive heart failure patients, they have astronomical levels of mercury, astronomical levels of antimony. So you know that well before heart failure occurs, you're accumulating, everybody's accumulating this as well. So you have the young people, early repolarization, accumulating the heavy metals. And then guess what else young people do? They have lousy diets, they don't supplement, and they sweat a lot. What does sweating do? Sweating loses magnesium. Magnesium hypomagnesemia inside your cells is the primary precipitator of arrhythmias, period. The primary precipitator of atrial fibrillation, period. And when this happens then, and this is why all the athletes in Europe were dropping dead, is because they're young, they have the factors that I'm talking about, they're extremely physically active, lots of epinephrine, lots of hypoxia at peak exercise, and then the spike protein comes in and they're all hypomagnesemic, boom, you have sudden death. And let me tell you, if we started seriously supplementing magnesium like nobody's doing right now, this would disappear or would be strongly ameliorated. Not to get too much into myself, but I had an episode of atrial fibrillation a month or so ago. I said, what the heck is happening? I was on a lot of caffeine, so I cut out all the caffeine. And then I did think to start taking a little more magnesium. And then 2 or 3 weeks later, it hit again. Only this time I had done an EDTA chelation, which released a lot of toxins, which irritated my heart, went back in it. But since then, none of that, extremely high dose levels of magnesium and I mean, not in a single extra beat at all. So it sounds like I'm blowing this out of proportion, but I'm going to tell you, unless there are physical, mechanical problems in the heart, structural defects, etc., the single reason for arrhythmias is hypomagnesemia. And one of the ways that if people started getting Holter monitors done with a lot of extra beats, and the thing is once you get really low in magnesium, it's very difficult to get it up with oral sources. So you really have to periodically start putting in magnesium IV to get yourself over the hump. Anyway, this is something that's, to my knowledge, not recognized at all, but extremely critical. And this is the other thing. This will stop or strongly curb the episodes of sudden death, because the episodes of sudden death are arrhythmias.
Amen to that.
And so you need to do Holter monitors, that if you see any extra beats at all, then before you go to the prescription antiarrhythmics, and I'm not saying never use them, you might need to use them at some point in time, but before you go to the prescription antiarrhythmics, you just hammer with magnesium. And I guarantee you, when you do follow-up Holter monitors, you'll see next to no abnormal beats at all, or even a completely normal rhythm.
That's awesome. And I will say, I am literally going around the world every week, flying somewhere, being asked to speak. And Dr. Levy, you should be proud. I've had chefs walk out of kitchens at restaurants in other cities around the world. I've had waiters, waitresses, pilots come and kneel next to me on a flight in the middle of the flight to tell me, thank you, Dr. Ardis. Like, they'll just say this, but this is what they all say. Okay, so 90% of all people that recognize who I am, this is what they say. You're that famous magnesium doctor from TikTok. I'm like, and then I go like this. I've never been on TikTok, but yes, people post a lot of clips of me talking about magnesium. There's been 60 million views on some, 50 million views, 30 million views of people posting these on their platforms. I usually
well,
will
as
bring
excited as I've been about
magnesium.
magnesium in the past, as you know, I wrote the book Magnesium Reversing Disease. And even though in that research, it also talks about magnesium and arrhythmias, it's only now that I realize magnesium is the sole reason. Hypomagnesium is the sole reason for arrhythmias. I would completely obliterate the arrhythmia subspecialty of cardiology as we know it if everybody started pouring on the magnesium.
And Dr. Levy, I'll speak to this. I had an 88-year-old father-in-law. Most people know the story. He died in early 2020, which is why I ever became a public speaker in the first place. But my father-in-law at 88 years old, 3 years earlier, so this would have been 2017, he was diagnosed with AFib at 88 and was on like it was either 7 or 8 different prescription medications to try to manage this AFib, and they just could not get it under control. I had in my all natural chiropractic clinic in Frisco, Texas, I had a what's called heart rate variability device. I took it to his home, ran his scan, and all I did was put him on 500 milligrams of magnesium. Now, you can do a lot higher than that, and I do recommend higher than that. I do 1,000 milligrams every single day. But this guy at 88, I gave him 500 milligrams, and within 2 days, Dr. Thomas E. Levy ran the heart rate variability again, 0 AFib, 0, nada. It was awesome. So just so y'all know, I have loved magnesium for the whole time I've been in practice. I do believe it's one of the most essential nutrients that the majority of human beings around the world are deficient in, and it is not talked about enough, promoted enough, marketed enough, and our medical professionals don't know enough about it. But magnesium, by far, I believe, is that essential.
As I always like to say too is, I mean, everybody pretty much knows about me and vitamin C. And then when they say, well, what's the most important supplement? I said, well, magnesium. Magnesium is the most important supplement because if you don't take vitamin C, you can get a partial compensation by taking other good antioxidants. If you're low in magnesium, there's nothing that can compensate for a low magnesium other than magnesium. So if you're low on magnesium, and nearly everybody is, because we live on the same toxic cesspool of a planet that we're being subjected to now, and toxins take out magnesium. So you take out magnesium, as they say, you got to pay the piper. You got to pay the piper. If you've been taking toxins have been taking magnesium out of your body for years, you got a lot of making up to do. And that's one of the problems too, is it's not recognized because severe magnesium deficiencies take a long time to develop. But that also means they take a significant amount of effort to restore. But IV, let me tell you about this one study in the 1990, I believe. They had patients on the intensive care unit with acute heart attacks. And it had been previously established that magnesium is good for heart attacks, blah, blah, blah. So this guy infused magnesium. He infused 24 grams over 48 hours. So he infused half a gram every hour, 48 hours. Well, compared with placebo or people that didn't receive magnesium, there was 50% less sudden death, 50% less arrhythmias, and 5 years down the road, with no additional supplementation, there was still a decrease in all-cause mortality in that group. So that's how vital magnesium is.
Oh, and just
but it also means that's why you got to take the IV. I mean, if you're really low in magnesium, a lot of people are just going to be pooping their brains out long before they get enough magnesium inside their body, because it could cause. I mean, what do they clean you out with for a colonoscopy?
They make you drink magnesium.
Right, exactly.
Yep, big old load of it. Yeah, that's very good. All right, so we've got about a minute left, but I want to speak to you, Dr. Thomas E. Levy, before we come on the other side of this commercial break in a moment. We're going to talk all about natural ways to address hypertension, high blood pressure. What are some of our natural recommendations? What are some of our dietary recommendations? What do we know? We're going to discuss that coming on the other side. But I do want to bring something up to the audiences, because I'm not sure you guys have gotten this from me yet. Every patient that used to come to me in my practice, if they ever asked me, or I found out on their paperwork that they had a root canal, I would hand them a document called the root canal cover-up. I would just hand it to them. Here, you need to go home and read this. And there is a direct, long-standing and long awareness that we have known, a long-standing direct correlation to root canals being performed and being in your face and your jaw, remaining for years, and it leading to disease outcomes, particularly autoimmune disease. And Thomas E. Levy just talked about breast cancer and the awareness there.
And I wouldn't be that shy. I wouldn't dilute it by saying correlation. I would say cause and effect.
It is very, very directly.
Yes.
Yep, very much. It is a very direct action, man. You have a root canal, you've got necrotic dead tooth bone underneath a cap. And if you have necrotic dying tissue, what do you think this is going to do to your body? It isn't healthy. Even if you had surgery and they cut off a portion of your limb and then they see that you have some portion of bone or skin that is dying, turning black, they do not leave it there. They cut it off. They know it's bad for you, except in your mouth, they cover it up with a tooth crown or cap, and you can't see that there's a dead, dying bone under there, and you've got dead bone in your face. Gangrene, and you are going to get sick. Please, everybody out there, don't ever get a root canal. Please do not ever do that. Don't recommend anybody go do it. And if some dentist tells you that, you just need to get a root canal. You go, thanks, just yank it out. Do not do a root canal. Please do not do that. Just tell them to take the whole thing, man. Don't leave any dead tooth in there. All right, we're going to be right after these messages with discussions about how to reverse prevent as best as possible your blood pressure being as normal as possible. All right, we'll be right back. All right, everybody, welcome back to the Dr. Ardis Show. We're back with Dr. Thomas E. Levy. We're going to be diving into everything high blood pressure and how it is we can address preventing and keeping our blood pressure in our body as healthy as possible to reduce our risk in the future, ever needing to call an ambulance, go to the hospital, worry about aneurysms or strokes in the future. That is my goal. Prevention without the need of intervention. That's the goal. All right, Dr. Thomas E. Levy, everybody around the world pretty much knows their blood pressure. You could ask them, what's your blood pressure? They'll go, oh man, last time it was checked, wherever it was, or this morning. They typically know what that means. There's usually two numbers. They'll give you a number, a high number and a lower number. And so one is up. You've got like 120 over 80 is what they consider the normal range for a human. 120 to 80 is the goal usually for MDs. All right. So what does the top number and the bottom number mean in blood pressure? I'd like to get people to understand what they're looking at. All right. So you got what's called systolic. That's the high number. What does this mean? And you have a diastolic, which is the low number. But typically we just hear the numbers from our healthcare professionals or from our devices at home.
Knowing how the heart beats just by definition, the blood pressure is pulsatile. It's not like you have just a steady pressure. You have a high pressure, then drop down, a high pressure, then drop down, a high pressure, then drop down with each beat of the heart. Now, the systolic, the top number, is important, not as important as the bottom number, which I'll get to, but the top number just tells you how hard the heart is contracting. Okay. And there might be a number of reasons why that occurs, but if it tracks really hard, it shoots the systolic very high. However, at least this is what we've been taught in internal medicine and cardiology. The real predictor of long-term problems is the bottom number, the diastolic number, because the pressure then never drops below that. So is your body being subjected nonstop, let's say, to a diastolic of 70 or 80 or 90 or 100? Within that range, you have a wide difference of long-term morbidity and mortality outcomes, just because that's how much harder it is to get the blood in all the different areas of the body. So it's just a number, but we have a lot of experience with it. Generally speaking, when people say, well, what's the best blood pressure? I would say something in the 110/70 range is really your best high blood pressure. But truth be known, your best high blood pressure, your best blood pressure is whatever level is as low as it could get without causing you symptoms. So if you have a 90/60, that's great, and you're feeling fine. Okay, and that's pretty much it in a nutshell on how you approach those numbers.
My wife is very typically in the 90s over like upper 50s and low 60s, and she has been the whole time I've ever known her. And so cardiologists always are like, oh, we need to get that up, or oh my gosh, you're
get it up. Oh my goodness.
Or no. They say this most often, you're going to live forever. Like that's what they think.
Okay.
Wow, you're going to live forever. And then I go like this. Every time they say that, I go like this. You know, the lower it goes, right? The closer they get to 0/0. That's dead. Just kidding. All right. Well, thank you for that. It was a great summary. So as the heart initiates contraction, you see the upper number is the increased pressure going through the blood vessels, the arteries you are testing at the moment with your blood pressure cuff. And then the diastolic is the pressure that remains in the blood vessels.
The steady state
that it's resting between those contractions. Awesome. I love that. Thank you for that summary. All right. So outside of everything you've studied, you are a incredible intellect and scientific mind and very knowledgeable on all things heart, cardiovascular, and nutrition. Outside of root canals, which we already talked about earlier, I want you to tell me, how would you address individuals who said, I am not on any blood pressure medication? We'll do the scenario first. We are not on blood pressure of any kind, but I feel like my blood pressure is getting higher than it normally is. And is there anything I should consider? Would it be magnesium number one? What else would you actually recommend in those scenarios for these individuals to consider? Dietary wise, supplement wise, what would you as a cardiologist recommend with all your knowledge?
Well, in order to give that answer the most significant impact, I have to step aside here and make the assertion that toxins cause all disease. Number one. Yes. High blood pressure is a chronic degenerative disease, one of many. And like all other chronic diseases, toxins cause it. Why is that? That's because all disease, 100%, is how many different biomolecules in my body do I have in the oxidized state? Okay, and where are they located? There is no disease other than that oxidation. It's like oxidative stress doesn't cause disease, it is the disease. So that's number one. All disease is oxidative stress. Number two is what causes oxidation? Pro-oxidants, the opposite of antioxidants. Number three is all toxins are pro-oxidant. Okay, so there is no toxin that's not pro-oxidant, which means, and there's synonyms. So a toxin is a pro-oxidant is a toxin. It may seem like semantics, but it's also important to realize, we talked earlier about this stew of toxins that we live in on planet Earth, and we can't escape most of them, okay, no matter what you do, and that needs a price to be paid. And we generally can't get enough antioxidants in to prevent the toxins from continuing to promote accelerated aging and accelerated chronic degenerative disease. Now, for whatever reason, it would appear that the arterial smooth, that the smooth wall, the smooth muscle in the walls of the arteries are relatively, not completely, relatively selectively hit by toxins more than other areas. I guess one reason is it's where all the blood flows. Okay, so you get out toxins, I mean, before they ever get into any sort of organ or tissue, they're in the blood vessel. So that's kind of like the first thing that gets hit, if you will, when you get a toxin hit. And what does this mean then? The toxins then, as we've talked about before, the toxins raise intracellular calcium, and then this puts the muscle into an agitated state of increased tension, prone to spasm. Okay. The antithesis of that and the antidote to that is magnesium. You take magnesium to bring the calcium down and you relax the muscles. Now, something we had also mentioned before, but this is important. I talked about how the heart, as a very high metabolic organ, selectively concentrates toxins. Well, the blood vessels, again, I mean, they're circulating the blood all the time. They're the distributing thing. They get a large amount of toxins too. And when you have toxin accumulation inside the myocytes of the heart or inside the arterial smooth muscle cells, you have an increased predilection toward any new stimulus or any new noxious agent, further aggravating the condition. Now, because of that, the best things to take for blood pressure, I mean, I got to say this right now because I don't want people to get too crazy. They got a lot of commercials out there, you know, take this device and concentrate on it and squeeze it, and you're going to get a normal blood pressure. That's horse manure. Okay. Okay. You might put yourself into a state of relaxation and temporarily bring your blood pressure down, but that does not resolve a huge unbalanced excess of toxins in your body that needs to be neutralized. So forget about the touchy-feely ways of dealing with blood pressure. And it's important because the higher the blood pressure goes, definitely, no doubt about it, the greater your chance of stroke, the greater your chance of heart attack, the greater your chance of most all diseases. So the best drugs, okay, are calcium channel blockers. Okay, because what do? They work at lowering the calcium, which is the primary pathophysiological reason for the presence of excess calcium and the spasm in those blood vessels. Ironically enough, and I don't think this could be said for many prescription drugs, because I'm no prescription drug fan. I think most people should know that, but long-acting calcium channel antagonists, the verapamil, the diltiazem, the nifedipine, the three different classes, decrease all-cause mortality. So how many prescription drugs actually are such a positive factor that they increase the length of time that you live? And that's, again, because they're dealing with blocking and reversing the primary pathology inside every cell in the body, factoring in every disease in the body. So in dealing with how do you get rid of this? I mean, well, you got to have a clean lifestyle, limit your toxin intakes as best you can. But we also mentioned the accumulation of heavy metals. This is what I call the hidden pandemic. Right now, we are all and have been absorbing heavy metals like sponges our entire lives. But nobody stands out because it's happening to everybody. Okay, unless you can't get a control group. There isn't a control group that I know of. Maybe there's some isolated population somewhere, God knows where that could be, but we don't know who that is or where that is. So there is no control group, but we have the evidence, and I'll briefly mention it. In congestive cardiomyopathy, big heart failure, in 1999, in the Journal of the American College of Cardiology, and I actually knew about this article, but it just didn't sink in. They did biopsies for people getting ready to get heart transplants, but they also did heavy metal levels inside the myocytes, the heart cells. Dr. Ardis, they had 22,000-fold, that's 2,200,000% more mercury inside those cells than normal cells. They had 1,100-fold, 1,100% more antimony inside those cells than in normal cells, and then a bunch of the other heavy metals as well. And so this comes around and says, antimony, Doctors don't know what antimony is. Most of them I've talked to, and most people have never heard of it. Well, it is a heavy metal, and it's just as toxic as arsenic. I mean, when you do relative toxicity studies, it's just as toxic as arsenic. Where does the antimony come from? Well, the mercury comes from people that have had mercury fillings in their mouths for decades. And that's that. There are other sources of mercury, but that's the lion's share. Where's the antimony come from? Plastic bottles. Antimony trioxide is used to make PET, the primary agent in making the clear plastic bottles that we drink water in all day long. Okay. And the longer it's in the container, the warmer the container gets. With acid, fruit juices rather than water, the antimony just skyrockets. Wow. But the point is we're all accumulating this. So part of the treatment, then, getting back to your initial question, what should people do? Well, they need to lead as clean a lifestyle as they can. As you say, good, very good. They need to avoid the sources of new toxins the best they can. But everybody, because of the fact that we're all in the same boat and don't realize it, we need to all be on a regular form of chelation. Now, if you're kind of sick, you could lean toward prescription or more vigorous chelation. If you're not sick, but you want to play a good role in detoxifying your body, literally, then there's a lot of non-prescription agents you can take on a regular basis. I will say this, I know you have a product now, and you did not set me up for this. Anybody, is that EDTA. EDTA eventually takes out all heavy metals. It has a few that it favors, okay, but it will eventually take them all out. It's good if you have access to an injectable form, but there are good pure forms when you take them orally on a regular basis. They have other prescription agents, DMSA. If you're kind of sick, that'll get it out of the heart pretty quickly, but it's very expensive. That's the problem with that too. They have copper ones, trientine, very expensive too. Other ones, which I call immunological sledgehammers, or DMPS, takes out toxins like crazy, but you really have to have someone with expertise to give large amounts of vitamin C so that you don't burn down the house to kill the roaches. I mean, it's really that powerful. But you have N-acetylcysteine, citric acid, ascorbic acid, carnitine, all of these things. It turns out that most effective chelators, or toxin mobilizers, I should say, toxin mobilizers, excretors, are either amino acids or derivatives of amino acids. So even the prescription ones are not that far away from a truly natural agent. But then the two biggies, sauna. I think one of the best health investments anybody can make is to get a home sauna and sweat yourself to death at least a couple times a week. Okay. But bear in mind this.
3 times a week.
Not literally.
You're going to die 3 times a week.
Remember this, though. You sweat out a lot of magnesium, too. So that's one negative factor. The rest is positive, but you really have to be pushing harder on the magnesium so that you don't end up with a problem like that. And then I might say, too, I put together what I consider, I'm not selling them, I don't have any supplements, but I put together what I call my Super 8 supplement package that addresses all of this. And I've just been seeing incredible results. I don't know, we've known each other several years. I don't think you probably, if you think about it, that I had this much energy in my voice a couple of years ago. I mean, I've just really skyrocketed.
You have
skyrocketed. What are they? Well, the front 4 are the ones that lower calcium. That's vitamin C, magnesium, vitamin D, vitamin K2, okay, in large doses.
Love them each.
The other 4 are those that support ATP production inside your mitochondria, because you'd never have a normal cell until you have normal vitamin C and normal ATP production. What are those for? Niacinamide, precursor to NAD, okay, riboflavin, precursor to FAD, coenzyme Q10, and methylene blue. Each one of those stimulates the 4 stages of the electron transport chain, and they are synergistic like you can't believe. I mean, I've just, My wife had a situation where she became acutely deaf in her ear. I mean, I was really upset. They were jabbing all sort of things. I said, get on these supplements, high dose. Within a week, she was fine. And that had been I was really worried about that. And I've had other results too. I don't want to get too anecdotal with everybody, but I just want to say, this is not to say if you're taking stuff that you like and it's great and it's working, take it. But if you want to ask, my recommendations include these 8. Include, even though say 8, that's a lot. Well, no, it's put them all together. It's one swallow full. I mean, economics, that's something else. A lot of people, I understand, don't have the money to get supplements, but
Sure.
if you do, and the thing too is, Dr. Ardis, these supplements affect the ATP and vitamin C status in every cell in the body. So there literally is no condition which won't benefit from this. All right. Recall that niacin and niacinamide alone, well, not alone, with vitamin C, was used, and I wrote a paper on this, to cure chronic schizophrenia by Dr. Abram Hoffer. All right. Reliably cure schizophrenia. And if you cure schizophrenia, that means you can cure any mental, neurological, any mental condition and ameliorate any neurological condition. Because a lot of conditions like that, they get advanced damage, so you can't reverse physical damage. But while something is percolating, you can knock it out completely.
Well, my audiences will love this discussion about schizophrenia, because one of the last discussions or presentations I did in Los Angeles, and they have seen it, was 3 studies on nicotine helping to remit all schizophrenic traits. Now you've got another one, niacinamide. You've got, just for reference, he said riboflavin was one of those 4. That's vitamin B2. And so just for reference, it might sound like a big science word if you're not familiar, but that's what it is. It's a B vitamin, which is phenomenal. I do want to ask you one thing. This is a great review, and the supplements I think are all great. One thing I do want to ask is, or just to remind the audience here, I didn't know this. When the EDTA I came out with about a year ago, when I came out with that EDTA, in my research before releasing it, I had found studies over and over and over that stroke patients, and you in this discussion is answering a question for me, because I could never figure out why it is they found this to be so successful. They said that even up to 2 years after a stroke, if you used EDTA chelation therapy, you could reverse all of the symptoms long-standing that were still there 2 years after the stroke. And what you said today hit home to me, the significance of the amount of mercury, antimony, and other metals that could be in the heart. It just put the heart in the situation in the cardiovascular system. I mean, all your blood vessels are just extensions of your heart muscle. So if it's in the heart muscle itself, it's going to most likely be in those blood vessels, impacting your blood pressure, stroke, aneurysm risk in the future, you name it. So the EDTA used even 2 years later to reverse symptoms related and cause because of a stroke are being alleviated with EDTA. That tells me that those amount of metals, which were the precursor to the stroke anyway, are still sitting there creating symptomatology and problems after the stroke. And as long as we can get those metals out using that EDTA, it was very, very beneficial. And just so everybody knows at home, Healing for the Ages is going to be showing you orally administered EDTA that we created. We've got 10 different people who we did different doses over a month period. We're going to show you exactly which metals come out of the body, which ones you pee out, sweat out, it comes out of your hair. We can actually tell you all which ones and which things you want to use to replace those minerals, because like sweating out magnesium and electrolytes, you need to put them back in. All right, Dr. Levy.
And you know, unless you have under the microscope fibrosis and scar tissue in a given area, you got reversibility. Okay, once something has died and been replaced by collagen, well, as far as I know, that's gone. But up to that point in time, it's all reversible. May not happen overnight, but it's all reversible. And even if a patient like your stroke patient you're talking about had significant problems, and he probably still has significant scar tissue, but there are still compensatory mechanisms where if you help the healing enough in the other areas that were not as severely impacted, then you can get what appears by all intents and purposes to be a clinical resolution of an advanced neurological disease.
I have two books I want to reference here. We're gonna have to sign off here. We're out of time actually. But Dr. Levy, I want you to mention where individuals can find your Cure Diseases with Magnesium book and where they can get their Death by Calcium book. I think these two are just two massively important things and concepts people need to have when looking to prevent cardiovascular disease and high blood pressure in the future.
TomLevyMD.com.
Rock and roll. All right. Thomas E. Levy, I appreciate you so much more than you'll ever know. I appreciate your friendships, being a colleague, being somebody I can rely on, text, call. You've been a monumental assist to me many, many times, and I can't thank you enough for all you do. Good luck with your move. I'm very excited for you. Is there anything that you're looking forward to besides moving into a new house you want to make the audiences aware of to look forward to or look for?
Well, specifically, no. I'm going to be going to Switzerland shortly, and then after that to India to talk about these concepts that I'm talking about. Toxins cause all disease, and a host of other in the States throughout the end of the year. But not much. I do like to say that keep in mind, even though this is not completely in the theme of what we've been talking about, probably my most significant assertion is there's more politics in medicine than there is in politics. Don't forget it.
God bless you, Dr. Levy. God bless you, audiences. We will see you next week.